I am an ophthalmic clinical officer, cataract surgeon. Right now we are at Mutolere Hospital. I hosted ophthalmologists from Mbarara University who come to assist me in eye operations, especially glaucoma and the cataracts. The project is sponsored by Lion's Comprehensive Eye Care Project for Kigezi region. My role in Kisoro as an ophthalmic clinical officer, I do screening, I do outreaches. The ophthalmologist from Mbarara came on 5th, that was Sunday, ready to start the eye surgeries on Monday. Yesterday, Dr. Sam Luvuma started the operations. Yesterday he operated on 11 patients. 10 of them were cataracts. One was a cornea repair. The cornea repair had a corneal injury. He was hit by a stone and the eye perforated. Those patients who were operated upon yesterday are seeing very well. They are very happy and they are very grateful. Me too, as the one heading this project in Kisoro, I'm very happy because my patients are seeing. I'm thanking the Lions who thought of these people who are blind, but blind due to cataracts and raised the intraocular pressure of glaucoma, because when my patients see, they have a lot of hope because they come back to a normal life.
Ndikumva nta kibazo kuza kuzamwa agasoma gakeya ariko nta kibazo
ubuhumye urukumbuzi
kumwe nta kibazo ariko ntabwo akantu gatoya gatoya.
So baba gufite nk'ibihe bibazo humye utareba
ibibazo ni byinshi naravukanye ubumuga
ndavuga byo
kutareba by'amaso wumva kumeze
zibaga mu rugo nicaye gusa ntabwo gandya ukicara gusa bwakwira ubona akantu ngo ngasubira mu buriri nkaryama.
umwana ari kujya
umwana
ntabwo bashobora kwijyana
rero impumyi imyaka ariko naravuka ni rimwe gusa ryarebaga irya ryarapfuye kera nkiri umwana rimwe nibwo ryarebaga ntirigeze nyuma naho ryaho imyaka ine n'umunani narimaze.
bakubwiye ngo iri ngiri ryahumye rite?
Ni ya ndwara y'abana
warwaye ise?
Yeah, I'm Dr. Ruvuma Sam Musinguzi. I'm an ophthalmologist and lecturer in Mbarara University of Science and Technology. I'm here now for a surgical camp under Lion's Comprehensive Eye Care, which extends services to the community, more especially to deal with this avoidable blindness, which is caused by a condition that we call cataract. So the lens, due to age or maybe injury or maybe some diseases like diabetes, the lens of the eye becomes opaque, and then it protects a person from seeing, and you find a person is blind. So yeah, we do some screening, and then after selecting those patients, then we are going to come and do surgery or remove that opaque and then replace it as you saw. So we came on Sunday night, and then yesterday we were doing that screening, and we screened a big number, around so far 45 cases, and then already 35 are due to be done on surgery. So by yesterday around 4:30 we had we decided to do some cases, of course. So I worked on 10 cases, Some of them were totally blind. I think perhaps you saw them. They were pulling them, guiding them to theater. Others were having one eye seeing, another eye not seeing. So those 10 cases that I worked on yesterday from 4:30 to 7, fortunately enough, I think all of them now are seeing. There are some 2 special cases. One man who became blind one eye when he was 4 years due to measles, and then another eye also was damaged, but it was seeing. So 4 years back, then that eye also got blind because of cataract. So today the man is happy. I mean, the life is back, and so both to him and to us as the people who are offering the services, honestly, we thank God for that. We thank God for that. And there's an old lady also. I think she told us that she's from Congo, the border, the other side of the border. And then also both eyes were blind, so we worked on one eye last evening. And then this morning you can see she's having a youthful face because she's smiling. So that one is also very important. So you can imagine the repercussions of these patients when they are not worked on. That man is around 47 years, but when you look at him, it's as if he's 65 years, simply because the life he lived just for 4 years, sitting on his veranda, waiting for a child to pick him and take him back to the bed or take him to the shower or what. Psychologically, that one affects his life, and you find the life is changing. Secondly, that child who is guiding him, that means he will not go to school. He has to keep at home to guide his father. So that means now the life of that child is in dilemma because he's not going to school, he will not attain any education. But right now this man is going back home. He will have to follow his cow or his goat, and he's happy with conversation. He visits his friends visit him, and he'll be happy. You find his health is again, at least looks better, and then the child will go to school because now he's no longer need to guide his father. So that is one. So the problem with this disease, if it's not addressed, you find life of the patient and even the family is all affected. But when it is done, the other positive side now he changes, he becomes okay, and then the child has to go to school. And then you find that both economically and maybe physically, there's some good changes in their family, in their community.
Umwana yavutse atagejeje igihe nuko aja mu byuma, biba ngombwa ko hasize icyumweru gitaha ageze mu rugo, hasize ikindi cyumweru sohotse hanze, umwana ntabwo ari kurambura amaso neza, umwana ntabwo arambura amaso neza, tumujyana ku bitaro Kigezi, biba ngombwa ko batwohereza i Kigali. Kigezi Kigali, umwana baramubaze, nta kintu biri gutanga, mbonye nta kintu biri gutanga, biba ngombwa ko baza kumuvuza.